Vande Matram. I'm pretty sure each of you might have experienced some sort of trauma in your life. Primary goal of Trauma Trend series is to increase awareness of trauma management and treatment, not only amongst medics and paramedics, but also amongst laymen so as to increase trauma prevention. You can reach out to me on various social media platforms by mailing or following these handles as mentioned in description. In Trauma Trend series, we will go through various definitions and classifications of trauma. In spite of heavy social impact, trauma has not been defined as a disease. So we will try to find out the reasons behind it. Few authorities label this part of medical sciences as traumatology. So we will also discuss if this terminology, that is traumatology, aptly describes the cause and management of any trauma patients until follow-up. We will try to explore various trauma events from different civilizations. We will overlook evolution of trauma management starting from medieval period till it became a super specialty in modern era. What were different types of injuries in wars and how were they managed? But emphasis will be laid on First and Second World Wars. We will also discuss various types of disasters and lessons learned from those disasters. As we all know, industrialization has definitely shown gross impact on trauma, making it one of few major factors leading to trauma. How countries are differently affected by trauma. What are financial implications to manage trauma in these different countries? We will discuss geographical distribution of trauma victims globally and try to compare it amongst continents and regions. We will also discuss trauma load amongst various countries with emphasis on Indian demography and try to compare it with other developed countries. We will compare trauma volume and its management amongst states of India. Because health is a matter of state and is dealt by the state government. We will discuss how age is related to trauma and how trauma management depends on age. But if we want to discuss demographic distribution of trauma victims, we need to know volume load. So, we will discuss how this data is maintained. What is trauma registry? We will try to unveil Haddon's matrix for trauma patients and how can it help us to decrease trauma incidence. Trauma care starts at the trauma site itself. That means well before the patient reaches hospital. So we will also discuss what are all those measures which can be taken as pre-hospital trauma care. Most trauma events occur unintentionally, but some has intent hidden behind it, like assault, homicide, self-harm, terrorist activities like ID blasts, so on and so forth. To manage any trauma patient, it is very important to understand basics of trauma events, where biomechanics play an important role in causation of event and type of organs injured. By and large, we will explore leading mechanisms of injuries depending on prediction of injuries related to demography. Entire spectrum of pre-hospital care provider agencies and institutions involved in trauma management, right starting from effective prevention to efficient societal reintegration of trauma survivors, are known as trauma system. And those special institutions and establishments which take care of trauma victims are known as trauma centers. So we will discuss in detail different levels of trauma center and its variants. We will discuss historically important disasters and injuries occurred along with their management. Triage is an important part of disaster management. What are variants of triage and why is it required? We will not only discuss how documentation is conducted at each stage of evacuation, but also ideal method of casualty evacuation. What are scoring systems used in trauma at various levels and why is it necessary? We will discuss in details how trauma patients should be managed at various levels, including initial management on patient arrival. Justifications for current protocol of resuscitation will be elaborated, though current trend to manage most trauma patients is inclined towards non-operative management. But we'll also discuss operative procedures if at all indicated. Then, what are all those protocols to be followed? And depending on the procedures, what and how post-operative care is taken. We shouldn't forget that if we want to keep the outcome of trauma patients positive, then we should remember only one thing, and that is timely teamwork. If you think that you, your family, your friend circle, and your social surrounding ever met any trauma in life, or if you think that by any chance this series will improve your level of knowledge and help in increasing chances of survival of any trauma victim, then please like this video and share it with your known ones to propagate and save lives of trauma victims. Don't forget to subscribe and hit the bell icon if you want to get notified when I upload next video on trauma trends. Now before we start the series, that is till our next video, please think, are we doing justice to humanity by at least trying to save a life? Or are we doing justice to our mother nature by increasing industrialization? Think, what all can be done to prevent trauma at different stages? What are various challenges faced, may it be administrative or legislative? What are recommendations and protocols put forth by various authorities? I request you all to comment below that should trauma be referred as a disease or not? Your comments are most welcome. Let me remind you that neither WHO nor any other World Health Authority has labeled trauma as a disease. Till then, stay healthy, work safe, see you soon, Jai Hind.